ABC News medical contributor Dr. John Brownstein for more on this. Dr. Brownstein, given that decline in testing that Whit mentioned and also the rise in at-home tests, how likely is it that these numbers are underreported, and how concerning is that?
Well, it's very concerning from a surveillance perspective. More people are testing positive by rapid tests than all other tests combined, Diane. So this is great for the individual, but it means that we're flying blind for really understanding what's happening. Our estimates suggest that the surge is probably 3 times greater if you include those rapid tests. And so we really don't have a full understanding of what's happening. And I do think it's contributing to some lax attitudes about what's taking place with the surge. The good news here is that with all these cases and still deaths at a low level, it does tell us that the case fatality rate for this Omicron surge is low. So we're seeing this decoupling between cases and deaths. But I still have this worry of, for the surge in the South where there's lower vaccination, lower boosting, lower testing. I still have a concern for a summer surge in the coming months.
An ABC News analysis of federal data shows a growing proportion of COVID-19 deaths are occurring among people who have been vaccinated. How significant is that?
So we really have to put the data into context. More people are vaccinated and boosted, so it makes sense that more people will ultimately be the one that are vaccinated, be the ones that die. But ultimately, the vaccines are still working incredibly well, especially when boosted. We know that immunity is waning, and when you get that additional immunity from a booster, you're really protected. In fact, you're 20 times more likely or less likely to die if you're fully vaccinated, and 7 times less likely to be hospitalized. So the data really suggests that these vaccines are working, even though, of course, this denominator is changing. So it does put things out of whack. It does, though, explain the fact that the community needs to get vaccinated because, elderly, immunocompromised, their immunity wanes much quicker. So the people around them need to be vaccinated and cocoon them and protect them essentially from the severe complications of COVID.
Now, the COVID landscape has changed dramatically since the onset of this Omicron wave. So what's the latest guidance on what people should do now if they test positive or if they find out they're a close contact of someone with COVID?
Yeah, I get this question constantly. Actually, things have not really changed in quite some time. According to the CDC, if you do test positive, you still need to isolate at home. Isolate for that 5 days, regardless if you're vaccinated. And then after that, you should take precautions. If you're still experiencing symptoms, you need to isolate for that full 10 days. If not, just wear a mask. But I highly suggest people use those at-home tests. They can really help you make a decision about what to do. If you're exposed, there is that difference between vaccinated or unvaccinated. If you're unvaccinated, you need to stay home for 5 days and take precautions for 10. If you're fully up to date with your vaccine, then you don't need to quarantine. At the same time, we have these at-home tests, so really use those because we need to understand when people are infected to really keep this surge under control.
All right, Dr. John Brownstein, always great to have you. Thank you.
Thanks, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.